what are the 4 different types of hearing loss? So there's 4, seems like a lot, but once I explain them to you, it'll make sense. So the most common type, number 1, it's called a sensory or a sensorineural hearing loss. Usually has to do with degradation of the very delicate, fine structure of the inner ear, those sensory cells. For whatever reason, whether it's noise damage or age, those are the big common factors. Those can stop working well, and it creates a sensory hearing issue. So sensorineural hearing loss is number 1. The second type of hearing loss is a conductive hearing loss. That's anything that's impacting the outer or middle ear system. So examples of a conductive hearing loss: a buildup of wax inside your ear canal, or a fluid accumulation in the middle ear cavity right behind the eardrum, or a combination of the wax buildup in your ear canal and the fluid accumulation in your middle ear. That's a conductive hearing loss. The third type of hearing loss is a mixed hearing loss. So that can be a degradation of your sensory cells in your inner ear, could be age-related, plus fluid behind the eardrum and or a buildup of wax. So a mixed hearing loss, something affecting your inner ear where the sensory cells are, usually, or an issue with your middle ear or outer ear system. So when you combine those two, it can be a mixed hearing loss. And then the fourth type of hearing loss is a functional hearing loss. It's where your brain kind of tricks you in thinking that you have a hearing loss. But from a pure physiological standpoint, you might not have hearing loss. It's really interesting, actually. So we can run through a full diagnostic test battery and find that your eardrums are moving well, your acoustic reflexes are present, so through the nerves, looking well, your cilia cells are working well. But once we get you in the sound booth and we have you listening for different sounds or repeating back words, you don't do well. And if you're not doing well with those behavioral results, despite good physiological results, then that's called a functional hearing loss. So the brain is an interesting thing there. So 4 different types of hearing loss: sensory or sensorineural, conductive, mixed, which is a combination of these first 2, and functional.
Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.